Hi, my name is Dr. Lauren Yancey, and I'm glad you could join me today so I can go over a few things before your appointment. Mainly, I'm going to talk today about cataract surgery and what it's like, and we're going to start off with the whole process. Cataract surgery is removing the human lens. The human lens over time becomes cloudy. It can either turn yellowish or it can turn whitish, but either way, it becomes no longer clear enough for you to see through the way that you used to. So what we're doing in cataract surgery is we are removing the human lens and replacing it with an artificial lens. First, let's talk about what different types of lenses we can use during cataract surgery. There are three main different types of lenses we can use. The first lens is what we call the basic or standard lens. That lens was the first lens invented for cataract surgery, and it will result in nice, crisp, clear vision. But because it does not fix astigmatism and it can only fix either far away or up close, you will need glasses for the majority of your vision. That is for both far away and for up close. If you currently wear glasses, it will be like rewinding time 10 years ago to when your vision was very clear, but you still had to wear glasses. If you're lucky enough not to have to wear glasses right now for all or part of your vision, that may change, and I will discuss that specifically with you during your preoperative evaluation. The second type of lens that's available is an astigmatism correcting lens, and that lens is going to correct everything that the basic lens does, but it will also correct your astigmatism, resulting in vision that can be used for distance or for up close, but typically we do for distance without glasses. That would mean that you only had to wear reading glasses for up close vision. That would be anything that's within your fingertips reach and up close. So that includes not just a book or a magazine, but also the food on your plate, the dash on your car, or anything that you can touch, including your laptop or computer, depending on how far away those items are from you. The astigmatism correcting lens is not covered by insurance. Anything that we're doing during surgery to result in you not having to wear glasses or having to wear them less, other than the standard lens, is going to be an out-of-pocket cost. Don't worry, no insurance covers this. It's just simply judged as a cosmetic procedure. And while we don't think of it that way, it's certainly more for convenience and it's not necessary. It's just really nice. So if you choose not to have your astigmatism corrected, then that is no problem. You'll just need to wear glasses as we discussed for the first lens. The price of the astigmatism correction will be discussed at your preoperative visit. The third type of lens that's available to you is what's called a multifocal lens or an extended depth of focus lens. These lenses give us more range than those first two options, and they also come in astigmatism correcting variations. So this lens will give you far away, just as the other ones did, but it will also give you in the middle at that fingertips distance that we were discussing, and multifocal lenses such as PanOptix Pro, which we offer in our clinic, will give you even up to 12 to 14 inches, which is a comfortable reading distance. With that lens, you should be able to check a text message, read a price tag, read a menu at a restaurant, see the dash of your car, especially your speed, and also read most road signs once they come into a reasonable distance. Now, it doesn't see way up close, and you're going to need it for dim light reading, such as a Bible, or reading in bed at night, or very small print. No medication bottle is going to be visible with an artificial lens without some help from reading glasses. And a golf ball is never promised. That's pretty far, depending on how good a golfer you are. But PanOptix Pro and other multifocals do give you that extended range of vision. One of the things we have to remember with multifocal lenses is that they do come with expected side effects. And you are the only one that can be a judge of whether these side effects are something that is no big deal or whether it's a deal breaker for you. Multifocal lenses specifically are going to cause halos at night. Most of my patients will tell me that these are more like rings or a glow or halo around streetlights, headlights, and taillights. Most people are not bothered by them, but if your career involves driving at night or that's something you do very frequently, it may not be the best choice, especially when thinking about multi-lanes in Atlanta traffic. Now, if you don't drive frequently at night, it might not be a big deal for you. Multifocal lenses don't promise perfect vision at every focal point. Most people fall into the category of 20/40 or better at distance, intermediate, and near when we measure them. I'm always fantastically happy if someone's 20/20 at all distances, and some people do get there, but most people fall in the range of 20/20 to 20/30 at those distances. Sometimes, due to poor neuroadaptation, which is just your brain getting used to the lens, some people just don't get along with multifocals. In that case, we may have to remove the lens or replace it with one of the astigmatism correcting lenses or one of the standard lenses, if that's possible. Or you may end up needing glasses despite having gotten the multifocal lens. Now, remember, with all of these lenses, there are pros and cons. Only you can be the judge of what is going to best fit your budget and what's going to best fit your lifestyle. No cataract surgeon can promise outcomes. A lot of that depends on the health of your eye, the health of your whole body, your lifestyle, even things down to how dry your eyes are or whether you suffer from allergies. All of these, especially the health of your retina, can affect your ultimate outcome. Not everybody gets to age and see 20/20 our whole lives. What we do promise is to give you a good, clear window to the retina and then allow you to see the best that you can possibly see. And that may be with glasses or it may be without. Now, ultimately, lens selection is going to be very personalized to you. We're going to review all the testing that we did as part of your preoperative evaluation, including the shape of the front of your eye, the shape of your entire eye, and the size and the placement of the lens. We'll discuss what your lifestyle is like and things that you've done in the past, like wearing contacts, monovision, or anything like that. All of this will be put together in the conversation, and I value anything like hobbies and passions that you can tell me about that may influence our choice. After this discussion, we'll come to a conclusion and ultimately you decide what lens is best for you. What I always tell people is I'm the baker, but you have to tell me what type of cake you want, and then I'm happy to bake it for you. I hope all of this has been helpful. As a little bit of a precursor to our visit, you're going to hear me say a lot of the same things again, probably even some of the same jokes. But that way we know that we've gone through everything we needed to know so that you're well educated about cataract surgery. I do not have any problem with you Googling and looking up and watching videos of. The more you are armed with knowledge when you come to this appointment, the better off it can be, and we can discuss it on a higher level. I look forward to meeting you, and I welcome you to Georgia Vision Institute, and I look forward to seeing how well we can get you seeing.